It's day 2 of the nationwide strike by nurses and midwives over conditions of service. Patients are bearing the brunt of the industrial action, which began yesterday. In the northeast region at the moment, JoyNews' Ilyasu Tanko reports a facility serving about 13 communities has been closed, leaving patients helpless. He spoke with some of the patients.
Babu Yoruba sunga ba za su tuma so mun ka lafiya malla BP
ka wula kayan nan pumpo
ka kuti nan mashin kana ayin nan man kaman ban yaddo atawa
ayepul kayina yimo kayina
yila wurko wana
kan kuma yepul kayan can
bayan do ata den za na ba za can la de strike so ya ko mi mai nan shi mun bugira
za ya ko bira tuwa
an kana ka doctor nan kan mo wula kayan
nan kan to ne lamne be wula
tanon wula Allah ba a doroma wula kayan nan
wa na ni jati na kala fula wa da tanga kan ma ka guhaman tematima la fula ba han korgo mu biken kamar lafna din yayi mi kayyana wai tam shati min kenan ka ba so bon te ni cikin hakan
blo bi haka mun cira ko pum bi haka bon shi cira ka ya ko hanya ko lema.
You're live on JoyNews today. Before we go to Ilyasu Tanko on the line, the first patient actually said that she's suffering bodily pains. She came to see a nurse and she's now going to a chemical store to get prescriptions. The second says that she's a BP patient. She's suffering from high blood pressure and she went for treatment, but she's told the nurses are not being paid, so they're on strike. So she's going back home to see how she can treat herself. Ilyasu himself has joined us on the line from the Vulugu Health Center in the West Mamprushi district of the Northeast region. It's a municipality of the Northeast region. So Ilyasu, earlier when we spoke to you, there was no one there. There was no health personnel there. There were just a handful of patients. Has the situation changed?
No, Daniel, the situation has not changed. People still come in. The point is that many people in these rural areas are not even aware the situation. They are not aware nurses are on strike, and so they continue to come in on motorbikes and on tricycles. But there's nobody here to attend to them, and they are forced to go back. I've been here for several moments, and people continue to come in from different localities. As you rightly said, particular facilities serve about 13 other communities, and some of the communities, the road networks are bad, they do not have electricity, no information flow, and so they come in with no knowledge of what is going on, only to be told that nurses are on strike, and so a lot more of them are stranded, and they are now resorting to drugstores for their prescriptions.
So typically, how far do these people have to travel to get to the Vulugu Health Center?
For instance, the person that I spoke to, he came with a child, and they said the child was having stomach pains. They travel from Kurgu, which is about 25 kilometers, but the road is very bad. Others are also coming from Ville, which is one of the cut-off communities, and they have to wade through the flooded waters before they are able to reach this particular communities. And so even some of them, even though some of the communities are not far from this, the Vulugu Center, but because of the road, the nature of the road is extremely bad, and there's no any kind of transportation there, so they have to come on motorbikes, they have to come on tricycles, and it's just a difficult situation.
And it's almost disheartening to hear you say, Ilyasu, that some of these people are facing a double tragedy with their homes devastated by floodwaters and also them being unable to access medical care because of the strike.
Yes, exactly. Their houses have been sitting in water for more than 2 weeks now. Their roads have been cut off. Their bridges have been flooded. And it's very difficult for them to move from their communities. And so when they get sick, they try all means to come to these particular nearby communities to seek healthcare. But unfortunately, the situation is that nurses are not there and they have to go back. I can tell you that most of them are now resorting to traditional healers. Of course, that is the main source of, health care for some of them. And so most of them are now relying on these traditional healers and the drug stores for their prescriptions.
Very unfortunate situation in the Northeast region. In the Ashanti region capital of Kumasi, Nana Aljima of our sister station Love FM has been to some health facilities in the metropolis and joins us live with more. Nana, what's the situation in the health centers you visited?
So, Daniel, let's start from the Princess Hospital, where this morning I visited, and at the Princess Hospital, the general ward and also the maternity services have been shut down in these areas because they, according to the medical superintendent, the nurses are very vital in providing these services. So when they gave them prior notice that they will be embarking on this strike action, they had to limit the number of admissions they do so that when the strike action starts, they wouldn't be in much of a challenge. So the two people who were in the ward when the strike action started yesterday were referred to other private facilities. The whole of the maternity unit is shut down. No nurse to attend to the people who come in there. So people come, they see the situation, and they leave. At Konfanoche Teaching Hospital, the situation is just like elsewhere in the country. The people or the patients are there to seek healthcare services, but nurses who facilitate the process are not there. But the doctors are stepping in, doing the job of nurses, so they are multitasking in all these areas.
Okay.
So I've been speaking to some of the doctors, and they tell me it's been very tedious, and it delays or slows the process.
Now, so you were telling me that because of this, it's become more tedious, more difficult. But how are the patients taking it? For instance, how many are they able to serve at a time? Make that picture clearer for us. No.
I couldn't hear you very well, but I think you're asking about how the patients are managing.
Yeah.
So the process has slowed down. Some people came as early as 6 a.m., but at 10 a.m., around 10 a.m., they hadn't been taken care of. They hadn't received the service they came for. So the absence of these nurses and the multitasking that the doctors are doing is slowing the pace. The patients are not happy with it, but since doctors have dedicated themselves to work even without these nurses, they will have to be okay with the service they are being provided and comply with the various instructions they are being given.
Daniel, thank you. Let's go to the Volta regional capital. Ivy Setoji reports there was not a single nurse at the whole teaching and municipal hospitals. Ivy has joined us with more. Ivy, this is the major hospital in Ho, isn't it?
Yes, please. So, Ho Teaching Hospital is the major hospital as well as the municipal hospital. But when I visited there earlier, I left there a while ago. I went there twice. There were no nurses at this hospital. The OPD is empty. No nurses were found. And I tried talking to some of the patients who wouldn't want to talk on camera, but said they are being turned away to private hospitals in the area. The same thing applies to other hospitals in the region, southern and other parts of the region. And now, a doctor I spoke to said that it is worrying for nurses to regard money more important than human beings. But at his hospital, he was able to convince 2 nurses to take care of babies who are currently on oxygen and some pregnant women who have to undergo some surgeries, and that there was no way he could send these patients or ask them to go to other hospitals. So this is the situation. No nurses were found in some of these hospitals we visited.
Ivy Sesoji, thank you very much for that update. Let's come back to the Greater Accra Regional Hospital, where doctors are picking up extra roles to contain the situation. Medical Director at the facility, Dr. Emmanuel Srofenyo, says the measure is unsustainable and wants governments to promptly settle issues with the striking nurses.
As I said earlier on, the kind of situation we have now is not sustainable. So we are only pleading on government to bring their good offices to bear so that this strike is averted, so that it will not lead to any loss of life or loss of maybe increased morbidity. The kind of system we are running cannot be the way to go. It cannot be the routine. It cannot become the routine. It can't really go that far. It cannot be the routine because then the doctors are being stretched. Let me give you one example. We have just about 150 doctors, but we have 700 nurses. And so when those 700 nurses are not there, the doctors cannot run their normal duty and then now come and take over the nursing functions. It is not possible because looking at even the numbers, assuming they could do, but looking at the numbers that have gone away, that is this hospital alone, do you see? So even the figures alone should tell us that the situation cannot be the way to go into the future. So sooner or later, we are only pleading that government will come into some kind of solution with the feeding staff so that they can resume. Nurses are clinicians who are providing service at the front line. And so when you talk about the criticalness of the situation, this situation is more critical than the previous one. And so we are not praying for a similar situation that happened in the past, that this thing will drag on for 2 months. It will really be a huge blow to the health system in this critical moment.
You're still live on JoyNews today with me, Daniel Dazi. We wrap up on this story having to do with the nurses' strike by hearing the Deputy Minister for Employment and Labour Relations, Bright Rekobrobe, who, well, we'll hear from the Deputy Minister very shortly, but first let's hear from some patients at that facility.
Okay, I'm coming here all the way from Amasaman through this heavy traffic to be here and just to hear that only one doctor would be available after waiting about 3 or 4 hours now. Only one doctor, and if your case isn't that severe, maybe you don't have anything showing you should go home, then you have to wait and see just one doctor in this big hospital. So I'm just going to take my lab and return home. And my case too needs immediate attention, but per what's happening, I can't be here for the whole day. And I don't even think I'll see the doctor because the number is large here.
But you didn't know that the nurses were on strike?
No, I didn't know. I heard about it yesterday. I was here, but I thought because it was holiday, that's why the place was not quite active. But today, it's like it's active and there are no nurses. That's why I came, and I'm coming for my lab to see the doctor. I was scheduled on 22nd, and they are not there.
So what are you going to do?
Maybe I'll go home and see a private doctor because they are saying, so we hear the nurses are back. And I don't know when.
Yesterday was holiday, so because of that, I should come on Tuesday. That is why I'm here this morning. So unfortunately, when I came for the lab test, I came so that the nurses would direct me to the doctor. But unfortunately, when I came, they said nurses are on strike. So because of that, if I'm having the lab report, I should go to the house. Then wait till the day that nurses will resume back to work. Then I will come. And they said only those on critical cases can wait and then hold on. A doctor will come and then attend to them. That's what they told us. So I'm waiting. If the doctor come and then they will attend to me. No, please. I just want to hold on and then see whether I'll be able to see the doctor, because they told me to come on Tuesday because yesterday was a holiday.
If you don't see the doctor, what you do?
Oh, please, I'll go back to the house.
Coming from?
I'm coming from Mama Sama.
Mama Sama. Okay, what are you going to do?
I'm going to come and look my child at Ridge Hospital.
Okay.
I've heard it, but the doctors are looking at us. They are looking after us, but we didn't see any nurse there.
So you want the nurses to come back?
Yes, we want them to come back.